Welcome back to Hardball. Ted Kennedy's absence is certainly felt in the fight for health care reform. Here's Senator John McCain yesterday on ABC's This Week.
No person in that institution is indispensable. But Ted Kennedy comes as close to being indispensable as any individual I've ever known in the Senate, because he had a unique way of sitting down with the parties at a table and making the right concessions, which really are the essence of successful negotiations. So it's huge that he's absent, not only because of my personal affection for him, but because I think that health care reform might be in a very different place today.
Well, is Senator McCain right? The Chicago Tribune's Clarence Page is a syndicated columnist, and the Boston Globe's Susan Milligan is one of the authors of The Last Lion, The Fall and Rise of Ted Kennedy. Well, it strikes me, Susan, that talking about health care without Ted Kennedy is like talking about emancipation without Abe Lincoln. You don't have the main signatory there. What is the condition of the senator as you can report it now for the Globe and for us?
Well, I mean, obviously it's very tough. He's got a very aggressive brain tumor. We haven't seen him outside in quite some time. His family has been very good about keeping him, keeping his day-to-day condition very private, but certainly he's not been well. He didn't go to his sister Eunice's funeral, and, that was certainly a sign of how things are. And I know that he would want to be in Washington right now trying to work on this health care plan if he could. Is
there a calculation? I know it's tough because everybody loves him up there and around the country. Most people do, actually. Do you think that he could make a vote in the Senate if he had to come down and make a vote?
Honestly, I know that people who don't know him think this is a crazy thing to say, but I can entirely envision a scenario where he'd somehow manage to get down there, be brought in with some assistance, and cast a vote for health care. I mean, I know it's that important to him, and I know that if it was within his power to do that, that he would absolutely do that.
Let me go to Clarence. Clarence, looking at this from around the country, the perspective, and you've covered the health care debate, and it's begun. Certainly was going on under Nixon. It was going under Carter. It's going under ever since Ted Kennedy's been a senator. His absence. It seems to me you don't have a quarterback on the field. You have a cheerleader in the president. You don't have a quarterback. You don't have Daschle. You don't have him. Where would we be without Hubert Humphrey for civil rights back in the 60s? It seems like that's where we are with health care.
That is where we are. There's little doubt of it. I think if we had Teddy Kennedy and perhaps Tom Daschle over in the House, maybe President Obama would have the legislation that he could really talk about right now instead of having 5 or 6 bills floating around over in Congress. You look at Teddy Kennedy's history. I think his relation with Orrin Hatch says as much as anything. Orrin Hatch came to the Senate with the idea of stopping Teddy Kennedy, as he put it, directly stopping Teddy Kennedy because he represented so much of the Eastern liberal establishment and its push for issues like health care. And before you knew it, Teddy Kennedy was working with Orrin Hatch. That was just how effective he was at working together on things that they could agree on, and actually got through COBRA, for example, to help out-of-work people buy health insurance, and WIC, Women's Infant and Children Programs. Things like that were what Teddy Kennedy has been so effective at doing. And I think if anybody could get some senators to support a public option, he could do it. Right now, there aren't enough votes for a public option in the Senate.
Susan, I have a bias here, and I'm allowed to have a bias. I believe in national health insurance, but I believe it could be done incrementally, and I think it should be done workably. And I'm not one of those who believes it's better to die in a good cause than to succeed. I've watched that happen with Ted Kennedy refused to deal with Nixon back when he offered an employer mandate back in '74. The failure of him to cut a deal with Carter. The failure of the Clintons to cut a deal with Jim Cooper and Dingell and the rest of them, and Pat Moynihan. It's easy to fail. And then you go and give a big war whoop and say, gee whiz, we did the best we could, and blame the other side. Kennedy, is it true that he would have been better at deal making than these guys on the field right now?
Oh, absolutely. In fact, the senator and I had a conversation about this several years ago where he said he did regret not having worked out something with health care with Nixon at the time. It was pay or play. They didn't want to do it. He wanted a straight-up national health care plan. In retrospect, he said they could have gotten something in place and fixed the details later, and that's certainly a lesson that he brought to, doing a lot of other legislation after that. But I think right now what he'd be doing in a way that only he can, and he's one of the few people with the authority to do this, is he'd go in and he'd say, look, stop fighting about these details. We have an opportunity to make history. This is really probably the third chance in his career that they had this opportunity. The first under Nixon, the second under Clinton. This is a third chance. And he said, you have to decide whether you're going to stand in the way of history or whether you're going to work out these details and get something done. He might make some compromises on it, but he wouldn't let this thing fall apart. I'm absolutely convinced of that.
Clarence, and then back to Susan. Here's the diamond that has to be cut. Do they cut a deal right now whereby they push what they can this year and they promise they're going to do more later? In other words, something along the lines of reform, pre-existing conditions, portability, things like that, cost-cutting, with the commitment they're going to move ahead with something with more universal coverage later? Or do they try to ram down this public option right down through the Senate with 50 votes this year? Where do you think they're headed right now in terms of that decision?
Well, I think they are moving towards some kind of a deal. Whether or not they're going to get that public option, though, is an important defining issue for Obama, particularly with his base, because there's a growing sense that if there's no public option, then what's the point? Teddy Kennedy certainly learned his lesson early on. He has often said he regrets not going along with what President Nixon wanted on health care, which I think in some ways is more radical, if you will, than what Republicans want to support now.
No, it's more radical than the Democrats would hope to get done. Ironically,
yeah,
Clarence, you and I are the same age. Nixon had an employer mandate. Employers had to have health care for their employees.
That's right.
That sounds like, well, I hate to use that word socialism that everybody's throwing around, but Nixon was so far out on this one. Susan, what are you thinking about all this thing now? Like, he might make it for a vote, basically.
I mean, I just wouldn't be completely surprised if he did that. I think if he's able to do something like that, he will. And as for some kind of deal, I mean, I think they're going to get something done. I don't know what it's going to be. I don't think that they're just going to let, you know, a handful of senators from a bunch of states that represent less than 3% of the population sort of kill health care. They'll get something done. It might not be exactly what they wanted, but they're definitely suffering for not having the senator there to kind of bust some heads, metaphorically anyway.
Well, to quote an old rival of the Kennedys, Adlai Stevenson, and a friend of Illinois, it's better to light a candle than curse the darkness. Thank you, Clarence Page, and thank you, Susan Milligan.